was brought in under emergency, I felt like an imposter because I had never had any mental health crisis in the past. So when I got admitted here, it took me a couple of days to adjust, and the nurses that attended to me, they made sure that I wasn't alone in my struggle.
York Region is the fastest growing municipality in Canada, and we feel it every day. I think one of the biggest challenges for the mental health program is just we really are very busy. And I think that's something that we have to tackle in innovative ways, because I'm not so sure that that's going to change and that things will be less busy 6 months from now, 6 years from now. I think a big reason why Mackenzie Health's mental health program is second to none is because of the range of services it has. We really believe that we serve everyone, and everyone means everyone. We have services to fit people rather than forcing people to fit our services.
We've been going through this for 13 years. He crashed in college.
Yeah.
And from college on, it's been a journey. It didn't feel so hospital. Once he got into his room and into the facilities, there's bright colors.
Yeah, I think it's more set up for the care of the patient.
Yeah.
It allows him a lot of freedom.
Oh, I loved all the groups. It always gave me something to do.
Providing our patients with communal space that is comfortable and inviting is so important. And although we do have beautiful spaces that are filled with light, it is really the staff that make the difference.
When we look at care for mental health patients, there isn't really an us or them. It's just us. Everyone that comes through is our potential family member. I do like the idea of building systems and building things that will endure over time, that are not dependent on one person.
What's special and unique about the programs here at Mackenzie Health is really our groups, that we get our patients involved. So for example, gym, pet therapy, yoga, and a lot of our staff, the social workers, recreational therapists, nurses run these groups so they're able to connect with them in like a different setting and have fun.
Yeah, I had some nights that bothered me. And I would always go see the nurses, and the nurses were very helpful.
It has to be a safe place. It has to be somewhere people feel that they can come to for care, and it has to provide hope. It can hit anyone, it can happen to anybody. Sometimes there's no rhyme or reason, sometimes we don't understand what happens, and all we can do is just be a guide for people and try to help where we can.
So we're getting our life back, which is good, AJ.
Yeah.
So are you.
Yeah. I have something every day.
This last year, we're back to date nights, which is wonderful.
After being here, I got to learn about how best I can take care of my body. I've learned to put what I learned, the way I was treated here, outside of the program. I will say I'm grateful that I made it this far, because I am grateful that I had a mindset shift because of the experience that I had here.
Our staff are so connected to each other that the environment that we work in is joyful and caring and compassionate, and that is a representation of how our patients are treated as well.
The commitment has always been to provide all the services as much as possible at both hospitals, and to never lose sight of the fact that this is our home.
No matter how big our community gets, we're still a neighborhood, and if we can wrap ourselves around each other to take care of each other, that's what our staff are really great at, and that comes from within.